The numbers are in, and there are still many Wisconsinites struggling to find health insurance after having to leave BadgerCare earlier this year.
But some local officials have a plan to bring the issue back into the spotlight. News 8's Brittany Schmidt joins us now to explain.
Mike and Lisa, the Crosse County Board has added an advisory referendum to the ballot. When voters head to the polls in about a month, they will be asked if they want the state to accept federal funds for BadgerCare, a program to provide health care to low-income residents. By putting it on the ballot, local officials are hoping to encourage the governor to take a second look at federal funds this November. Last year, Wisconsin Governor Scott Walker made the decision to decline federal funds when it comes to BadgerCare because he wants people to take control of their own health care.
To think that the governor would turn down such a huge pot of money as is being offered through expanded Medicare just for ideological reasons is really incomprehensible.
The decision ultimately forced more than 65,000 Wisconsinites off the program.
These individuals not only could have stayed on BadgerCare, but many more could have newly gained access to it if the state of Wisconsin had accepted federal funds. But instead, we have the opposite.
Over the year, many found coverage through the marketplace, while others went through private insurance companies. But more than a third, or about 26,000, are still without coverage in Wisconsin.
There are over 1,000 people just in Monroe, Vernon, and La Crosse alone who are now stuck in this coverage gap.
Here is a breakdown of the numbers for La Crosse, Monroe, Jackson, Vernon, and Trempealeau counties. In La Crosse County, more than 1,200 people had to leave BadgerCare. Almost 500 are still without insurance. In Jackson County, more than 300 residents were removed, with about half still looking for another option.
As a local elected official, there are nearly 500 of our neighbors and friends who are without coverage, and that's not right.
In a final effort to change the governor's mind, the La Crosse County Board has added an advisory referendum to the November ballot.
We have tried passing resolutions. We've communicated with the governor and the state legislature to no avail. And so an advisory referendum is really the best tool that we have as a community to chime in on an issue of importance to us.
Because the referendum is advisory, a yes vote would only let Governor Walker know what the residents want. If he changes his mind, which he can do at any time, over the next 7 years, La Crosse County alone would take in an estimated $117 million to help uninsured residents gain affordable coverage.
Thanks, Brittany. La Crosse County is just one of about 20 other counties across the state that will have this advisory referendum on the ballot.